Welcome back to the channel, everyone. I'm Dr. Dickenns, an orthopedic surgeon. So Daisy Ruto asks, can hammertoes be repaired and what is the fastest way of doing it? So in this video, let's dive a bit deeper into the hammertoe deformity. This hammertoe deformity is actually a common condition, especially in older adults. According to some study I've just seen, it actually affects about 20% of adults above 65. And it's more common in women than men, and it affects mostly the second and the third toes more than the other toes. This deformity actually occurs when there is sort of an imbalance in the muscles and the tendons that control the movement of toes. So basically what's happening here is the tendons at the bottom of the toe that are supposed to bend the toe are kind of stronger than the tendons at the top here that are supposed to straighten the toe. So the toe sort of curls like this. Now there can be two types of this hammertoe deformity. There's a flexible one and a rigid one, In the flexible one, the affected toe can still be straightened manually, but the rigid hammertoe deformity cannot be straightened. It's rigid. And in both types of the deformity, the joint at the base of the affected toes becomes fixed and bent. That causes a change in the alignment of the bones of the toes and causes them to curve or twist this way. So how do you now treat this condition? The management of the hammertoes basically depends on how severe they are. There's the mild cases like the flexible ones. Simple measures like wearing a shoe with a wide toe box or using toe pads, can provide some relief. You can always get those pads, in some of these physiotherapy, orthopedic appliance shops out there. Physiotherapy is also sometimes helpful in improving, the overall strength of the foot and its flexibility for the toes. But when the hammertoe becomes more severe, sometimes it might be necessary to perform surgery. Surgery in this case will be repositioning those affected tendons. Sometimes you could transfer this tendon from the bottom of the toe to the top of the toe. And for more advanced rigid hammertoes that probably even have arthritis at the joints of the toes, it might even involve doing some work on the bone, like cutting off some portions and so on. So there is quite a number of surgeries that your orthopedic surgeon will do for those severe hammertoes. But it's also important to note that prevention for the hammertoe deformity is actually top on the line. It can be done by wearing shoes that fit you properly, having enough room for the toes to move freely, not those shoes that kind of compress the toes so much. You have to be comfortable in well-fitting shoes, and it's important to maintain a healthy weight, exercise regularly, and basically keep your feet strong and flexible. Thanks for watching. I hope you found this video informative. If you did, please hit the like button and subscribe to this channel for more content. See you guys in the next one. Bye.